According to different studies, zinc is effective against various viruses like herpes simplex virus, picornavirus, varicella zoster virus, different respiratory viruses, even SARS coronavirus through various mechanisms. But what is the role of zinc in COVID-19 patients? According to different studies, I'll discuss here some proposed mechanism of zinc against COVID-19. The first mechanism, zinc significantly improves cilia morphology and increases ciliary bit frequency, thus improving mucociliary clearance and removal of bacteria and virus containing particles. By upregulating tight junction proteins ZO1 and chlorine 1 and increasing antioxidant activity of respiratory epithelia, zinc also increases barrier function of the latter. In turn, coronavirus infection was shown to impair mucociliary clearance, predisposing the lung for further viral and bacterial aggression. Zinc may also possess antiviral activity through inhibition of RNA-dependent RNA polymerase activity and blocking further replication of viral RNA as demonstrated for SARS-CoV. Indirect evidence also indicates that zinc may decrease activity of angiotensin converting enzyme 2 that is known to be the receptor for SARS-CoV-2. The modulation of antiviral immunity by zinc may also limit SARS-CoV-2 infection at least through upregulation of interferon alpha production and increasing its antiviral activity. The latter may be mediated through interferon alpha mediated JAK1 STAT1 signaling and upregulation of antiviral proteins RNasel PKR known to degrade viral RNA and inhibit its translation. Now, 4. Excessive inflammatory response resulting in overproduction of pro-inflammatory cytokines and cytokine storm is known to play a significant role in COVID-19 pathogenesis. In turn, zinc possesses anti-inflammatory activity through inhibition of IKK activity, that is a kinase enzyme, and subsequent nuclear factor kappa B signaling, resulting in down-regulation of pro-inflammatory cytokine production. Modulation of regulatory T cell functions by zinc may also limit excessive inflammatory response as well as down regulation of pro-inflammatory cytokine production. So it is also inhibiting the cytokine storm. 5. Given a high risk of bacterial co-infection in viral pneumonia, zinc-induced inhibition of S. pneumonia growth through modulation of bacterial manganese homeostasis may also be beneficial. Zinc status is also associated with risk factors for high COVID-19 mortality, specifically aging, immune deficiency, as well as metabolic diseases such as obesity, diabetes, and atherosclerosis are known to be both risk factors for high disease mortality and zinc deficiency. In turn, zinc supplementation may have beneficial effect in modulation of at least some of these risk factors. So, mucociliary clearance, next immunomodulatory role, antiviral property, cytokine storm controlling property. This all supports hypothetically the action of zinc against COVID-19. More thorough research or study needed immediately so that the patients get benefits.